Hello, my name is Alicia. I'm going to be your nurse today. I'm going to perform the head to toe assessment. Is that okay?
Yes.
Okay, I'm going to do hand hygiene and we're going to get started. Can I have your first and last name and date of birth, please?
Alicia Crawford, 1109.
Okay, so I'm going to ask you a few questions. Do you know who you are?
I'm home.
All right, do you know the point of your visit today?
The head to toe assessment.
All right, can you tell me who the president is?
Joe Biden.
Great. All right, so the client is alert and oriented ×4. So I'm observing my client. I can see that she has good health. She's able to walk straight. She speaks clear. She's able to sit up straight. Has good hygiene. All right, do you mind sitting up and walking for me to the couch and coming back? Thank you.
Who's got that?
All right. I didn't notice any body or breath odor, and her posture is good. She doesn't have any visible lesions or scars, and she doesn't have any skin discoloration. I can see from her face that she looks relaxed and shows no sign of stress. Her face features are symmetrical when she speaks, and she shows no sign of distress. Her skin is normal for her ethnicity, and her head shape matches her body. She does not have any abnormal movements or twitching in the face. Everything is controlled. Her face is also symmetrical. One side is not drooping. They're the same. Okay, can you close your eyes tightly for me? Open them up. Smile. Frown. Puff up your cheeks. Great. She did it with ease, so her cranial nerves are intact. So have you noticed any changes in your skin?
No.
Have you had any growth, hair loss, rashes, anything in your skin?
No.
Okay. Do you have any skin allergies? She doesn't have any lesions or scarring or any discoloration on her skin. Each side of her arm are both equally warm.
Is he out?
No. She isn't dehydrated. Do you mind if I see your hands?
Yes.
Alright. Thank you. She has no abnormalities on her hands. Okay. I see you wear glasses. Do you have a specific reason to why you wear glasses?
Yes, I have astigmatism. Ugh.
Do you have any issues besides astigmatism?
No.
Do you have any halos around lights or any blind spots in your vision?
No.
The squares of her eyes seem to be white and she's blinking appropriately. I need you to look over my shoulder, please.
I'm sorry.
No, you're doing good. You look up. Okay, her pupils are equal and her eyes are in alignment. Oh, she can't sleep. Okay. Have you noticed any changes in your hearing?
No.
Okay, that's great. Alright, can you look ahead for me? So she's able to respond when I talk to her. She knows the date and time, and she also knows where she is. Okay, so her ears are in alignment, and I don't have to repeat my question, so I can see that she's not having any trouble hearing. Do you have any pain or ringing in your ear?
No.
Okay. Do you ever have the feeling of dizziness or that the room is spinning?
No.
Okay, that's good. Okay. So I know allergy season is approaching. Do you have any congestion or sinus issues?
No.
Okay. Do you have any spontaneous drainage of bleeding through your nose?
No.
Okay, that's good. And have you noticed any changes in your smell?
No.
Do you have all of your own teeth?
Yes.
And what is your dental regimen?
I brush my teeth twice a day and I floss.
Have you noticed any sores in your mouth?
No.
Any changes in your sense of teeth?
No.
There's no redness or draining in the ears, which is good. Okay, do you have any difficulty breathing out your nose? Do you feel any tenderness?
No.
Okay. Okay, so I'm going to need you to brush your hair so I can examine your nose. Okay, so I didn't see any inflammation or nasal discharge. And your mucous membranes are pink. Okay, so I'm going to take a look at your mouth. I'm going to need you to say ah. Stick your tongue out. Ah. Okay. Okay, mucous membranes are pink and I'm not noticing any sores. Alright, so when you see my stethoscope move, just take a deep breath, okay?
We're all done with your respite.
Her scapula is also symmetrical and she has not been using any accessory muscles. Okay, so she has symmetrical movement. Okay, so can you please lean forward with your arms around your chest? Deep breath. Alright, so I'm about to start your exam. Breathe normally. Make sure you sit up straight. After 60 seconds, the apical pulse rate was 96 beats per second and the pulse was regular. S1 and S2 are present in all areas without any additional heart sounds. Capillary refill was less than 2 seconds. Okay, do you have any pain in the abdominal area?
No.
Alright, I'm going to check your stomach quadrant. Okay, thank you. She has no scars or lesions on the stomach I don't feel any masses or bulging. Bowel sounds are present in all 4 quadrants. The color of her stomach is right for ethnicity. Her stomach is flat and symmetric, and she has no scars or lesions. Do you have any questions or concerns?